everyone. Thank you for joining us today. My name is Congressman and Dr. Raul Ruiz. I represent California's 36th district. It's in the eastern Riverside County, the San Jacinto Valley, the San Gorgonio Pass area, as well as the Coachella Valley and Blythe in Southern California. I am an emergency medicine physician and a public health expert with training in humanitarian and disaster aid. I'm also the chair of the Congressional Hispanic Caucus. It is a pleasure to welcome you today as the CHC honors National Farm Workers Awareness Week by hosting a discussion on protecting farm workers from COVID-19. I'm the son of farm workers, and I grew up in Coachella, an under-resourced farm worker community. I first lived in a farm worker trailer park. My farm worker parents and neighbors taught me the values of hard work and taking care of one another. Because of this, I've been advocating tirelessly for our farm worker communities in Southern California and around our nation, especially during this public health crisis. The COVID-19 pandemic has highlighted the importance of food and nutrition to prevent illness, heal from COVID-19, and how important a stable farm workforce is for our food supply chain. Farm workers are amongst the highest risk to get infected, infect others, and die from COVID-19. They're literally dying to feed you, to feed all Americans, so that we can stay healthy and beat this virus. We must honor the work of high-risk essential workers like farm workers who have served our country during a time of great need by protecting them from COVID-19 and helping them stay alive. Today's discussion will be bilingual. Some will be in English and some in Spanish. I will now say a few words in Spanish. Los trabajadores agrícolas han arriesgado sus vidas a diario mientras continúan trabajando en la primera línea de la pandemia. El caucus hispano del Congreso está muy orgulloso de apoyar a los trabajadores agrícolas y proporcionarles con información y recursos sobre la protección del virus. Today, we will hear from two panels. First, we will hear opening remarks from the first panel and then have a question and answer discussion. After that, we will go to the second panel for opening remarks before holding another question and answer discussion. So for our first panel, we have brought a premier doctor, a COVID-19 expert, also known as America's doctor, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease. And we're also joined by the United States Department of Agriculture Secretary Tom Vilsack. After the first panel, we hear from a second panel. The second panel will be with Teresa Romero, President of the United Farm Workers, Dr. Eliseo Perez Estable, Director of the National Institute on Minority Health and Disparities, and Millie Treviño Sauceda, Board President Emeritus of Líderes Campesinas and Executive Director of Alianza Nacional de Campesinas. I also want to recognize my co-host and co-moderator, CHC's very own Congresswoman Sylvia Garcia. Congresswoman Sylvia Garcia was elected to the U.S. House of Representatives in November of 2018 and is the first Latina to ever represent the Texas 29th Congressional District. Congresswoman Sylvia Garcia serves on the House Judiciary and House Financial Services Committee. She is a native of Palito Blanco, a South Texas farming community. She is a doctor of farm workers and worked in the fields herself. Her perspective will be valuable in this discussion as a Latina and someone who understands firsthand the experiences of farm workers. Now I'd like Representative Garcia to give her opening remarks. Don't forget to unmute yourself.
Minor detail. Thank you, Chairman Reese, for such a great introduction and for putting together this panel for the Congressional Hispanic Caucus, and to our special guest, Dr. Fauci and Secretary Vilsack. Thank you for coming. Bienvenidos. We hope to have a good conversation about the realities facing farm workers all across America. While I am proud to know that the House has worked diligently to pass the American Rescue Plan and the Farm Workforce Modernization Act, among others, there's still much work to be done. Make no mistake, agricultural workers are crucial to our economy, and these bills recognize the humanity of farm workers and their families, not just focus on them as people for labor, but to look at the humanity of the families themselves. You know, Dr. Reese, with your introduction, it reminded me of the days of having to pick cotton. And as I tell my friends now, and even my nieces and nephews, and rest assured, I didn't do that for fun. And I didn't do it to buy a new pair of Nike shoes. I did it to help my family and to help hold our families together. And I can tell you, when we had the hearing on the Farm Workforce Modernization Act, that's the reason that farm workers are still out there working in the fields, to keep their families together, to make sure that they can have a good quality of life. But regrettably, not much has changed. Dr. Fauci, I still remember working in that South Texas heat, picking cotton at a young age, and getting so sunburned, and sometimes even to the point of getting a nosebleed. Of course, I didn't know that that's what happens when you get too much heat. And no, we weren't didn't get the rest stop. We just got to go back to the wagon and get underneath it. And as soon as I stopped the nosebleed, I was sent back to the fields. You know, there was a lack of medical care then. There's still a lack of medical care. We didn't really get rest breaks. That still exists in Texas. And I know as a Texas state senator, I try to pass a law that would mandate rest breaks. And we still don't have that in Texas. I'm not sure if we have it across the country. The lack of medical care is real then as it was today. The lack of the food and being able to just even go use the bathroom. We had to do it out in the fields or behind a bush somewhere because there was no facilities. So it just breaks my heart that what I face is still faced by many young people across the country. I remember one young person who testified before our hearing, and she talked about that, and she was almost in tears, and she said that she had to do it because that was her way of helping her family. But since the pandemic, we know that this is an area where, you know, I get to work from home. Many people get to work from home, but farm workers can't. In fact, they're out in the fields picking crops, doing the essential work to make sure that we can stay at home and that we can feed our families. So this is really about a conversation on what else we need to be doing to make sure that all our farm workers are protected, that they get the testing that they need, that they get the vaccines that they need, and that they have a better quality of life. So I'm looking forward to the full discussion, not only with the first panel, but again, the second panel, who can tell us what's really happening on the ground and what our next steps should be. So, Mr. Chairman, with that, I yield back and let's get rolling.
Thank you, Representative Garcia. It is now my honor to introduce to you our first speaker, Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, who will give opening remarks. Dr. Fauci, the floor is yours.
Thank you very much, Chairman Ruiz and Congresswoman Garcia and the Congressional Hispanic Caucus for organizing this really important discussion. It's a pleasure to be joining on this panel with Secretary Vilsack. I want to thank, first of all of the farm workers, as you mentioned, who have really helped keep our country going through this extraordinary challenge of this pandemic. I think they are very underappreciated in the work they do to keep our country going. We are still right now, as you know, from the last few days of the press conferences that we've given at the White House, at a crucial point in the pandemic, where we are seeing a plateauing and now even an increasing in cases, which is very disconcerting. We had a major peak following the holiday season of Christmas and New Year's and through January and early February. Then we had a precipitous drop downward, but now we've plateaued at anywhere between 50 and 65,000 cases a day, which is really very precarious. I tell you that because now is not the time to pull back on mitigation efforts. Having said that, I am fully aware of how difficult it is, given the conditions of the work that the farm workers have to do, how difficult it might be for them to protect themselves from infection, because they're out there on the front line, exposed in a situation where they may not have the capability. But nonetheless, we urge them to do whatever they can to modify the risk of getting transmission by wearing a mask where possible. I know it's not as easy. I just totally appreciate what Congresswoman Garcia mentioned. It's not the easiest thing in the world to keep washing your hands when you're out in the fields. I mean, I certainly appreciate that, but to do as best as you possibly can. Vaccines are going to be the answer to what the problem is that we're facing now. And that gets to something that is very important on the agenda of President Biden, and that is equity as the top priority in the distribution of vaccines. And what he's done, and hopefully it will spill over to the farm workers, is established numerous community vaccine centers that are placed in areas where the demography is of the greatest need. In addition, pharmacies stocked with vaccines in areas that are accessible to places like where farm workers work, and mobile units to get out into the poorly accessed area. All of these things are a very, very important part of the agenda that President Biden has put forth. So hopefully that will facilitate getting as many farm workers vaccinated as quickly and as expeditiously as possible. So I'll stop there, Raul, and yield back.
Thank you, Dr. Fauci. Now we will hear from Secretary Vilsack. Don't forget to unmute yourself. Thank you.
Mr. Chairman, thank you very, very much. And Congresswoman Garcia, thank you as well for the opportunity to be here. I should also thank you for the opportunity to be on the same panel with Dr. Fauci. And since I may never get the chance to do this in person, Dr. Fauci, thank you for your service to the country, not just in this pandemic, but throughout your entire distinguished career. We are fortunate and lucky to have you in the position you're in. And we are also fortunate and lucky to have the nearly 3 million hardworking farm workers who go to work every single day to make sure that we have among the safest and most diverse food supply in the world. The United States of America is a food secure nation, which means that we're capable of producing everything we need to feed our people. There are very few places on earth that can say that. And one of the reasons we can say it is because these farm workers come to work and they do literally backbreaking work every single day to put groceries on our table and to feed our families. I think they need two things in this time of crisis and COVID. First of all, they need protection. And that's one of the reasons why I applaud the House and the Senate for the passage of the American Rescue Plan, because it's now going to provide additional resources above and beyond what's already been provided to make sure that farm workers have access to the personal protective equipment necessary for them to guard against and to limit the risk that they take in terms of getting COVID. And we at the U.S. Department of Agriculture will do everything we possibly can to make sure that those resources are made available to as many farm workers as possible. They also have an opportunity with the Specialty Crop Block Grant that was passed in previous COVID packages to encourage states to also provide additional protective equipment. And while this is a farm worker discussion, I think it's fair to say we should also talk about those who work in our processing facilities, because they too are at enormous risk, and they too are just as integral to the food supply as our farm workers. And they too will need and should have personal protective equipment. The United States Department of Agriculture is committed to providing the resources. We're also committed as well to the day when we could potentially convert farm workers to farm owners. And there's an opportunity here with the passage of the American Rescue Plan and the section and portion of it that's directed to socially disadvantaged producers to create a template, a roadmap for how socially disadvantaged individuals can emerge to become successful farmers. I'm excited about the opportunity, not just at debt relief, but also utilizing the resources to strengthen the supply chain, learn more about how we can convert and encourage people to convert from being a farm worker to a farm owner. But to do that, farm workers need something else from the United States government, and that is they need peace of mind. And that's why the Farm Worker Modernization Act, which was passed by the House, is so incredibly important to get done. Certainly hope that the Senate takes it up as quickly as possible and in the same bipartisan way passes it so it gets to President Biden's desk for signature. This will provide over 3 million workers the peace of mind that they will not be disturbed. They won't be stripped from their families. They won't be taken away from their income opportunities. And they will be given an opportunity to ultimately join the ranks here in the United States, bringing them out of the shadows and putting them into the opportunities that this country presents, that the chairman expressed a great example of. We want to see more of that American story replayed. So I appreciate the opportunity to be here today. I look forward to the questions, but I will tell you USDA is committed to making sure that we do everything we can to protect and advocate for farm workers.
Thank you, Secretary Vilsack. It's important to mention that Secretary Vilsack served as the USDA Secretary for 8 years under President Barack Obama. And just by hearing him, you can understand his intimate understanding of the agricultural industry and farm worker issues. Thank you for your remarks, Secretary Vilsack. Now let's get the conversation going. The first question is going to go to Dr. Fauci. You know, during our hearings in Energy and Commerce, we often talk about equity. And you mentioned it earlier. The farm workers are some of the most hard to reach and also highest risk. And the numbers are showing that they're getting infected, they're infecting their family, the community, and also dying from COVID-19 at a much higher rate than the general population. And you also mentioned that there's an disturbing emerging increase in infection rates due to the variants that we're seeing in our country. Can you paint the scenario of leaving out leaving behind a community like farm workers and packing house workers and others during this rapid rise of infections due to the variants? And how will that affect our efforts in addressing the pandemic for everyone?
You know, Congressman Ruiz, what you say is extraordinarily important. You cannot leave out any individual groups, because if you have pockets of increase of infection in any group, that is obviously a very difficult situation for the group in question, but it also leads to the spread to other areas, because these people that you know so well have families, their families interact with others. So it really is unacceptable to say that the rest of the country is doing well in containing the infection, but you have individual groups like farm workers who somehow or other are left out of the protective umbrella that we have. And it's for that reason why the point that you made in your question of why equity is so important, not only equity and availability and accessibility to vaccines, but equity to all of the things that one needs to do to give you the opportunity to be able to protect yourself against infection. The next few weeks, Raul, are going to be a very critical part, because we're seeing this potential surge of infections at the same time as we're vaccinating more and more people. It's going to be almost a race between getting people vaccinated versus avoiding a surge of new cases.
Thank you. The next question to Secretary Vilsack, and then Representative Garcia will ask some questions to the both of you. But Secretary Vilsack, one of the risk factors why farm workers are getting infected at a higher rate is the overcrowding situations, their living environment, where oftentimes, like in my family, we took care of my grandmother for over 20 years, and there's 3 generations living in small units, sometimes two bedroom trailers or 2-bedroom low-income housing or farm worker housing. What's the USDA doing to assess these different chronic conditions that aren't suitable for public health in order to remedy some of those?
Mr. Chairman, I'm very familiar with the housing situation for our farm workers. I did some work down in McAllen, Texas, building homes for migrant workers, and saw the housing conditions that they were moving out of into these new homes. And it was really, really tragic to see. The United States Department of Agriculture does have a program that is designed to provide assistance and help to ensure that we have adequate housing for farm workers. And we are implementing that program and looking for additional resources into that program in order to provide the kind of opportunities that you and I think these hardworking families ought to have. And frankly, we're going to look for ways in which we can deepen our connection at USDA between USDA and farm workers. I think we need to have a greater presence on the platform, if you will, advocating on behalf of farm workers. And I think to the extent that we can beef up our commitment in our partnership programs to entities like United Farm Workers, looking for opportunities to be able to better advocate, to better educate you as a member of Congress. Not that you need educated, but many of your fellow members of Congress do, about these housing conditions so that they can see fit to provide additional resources to USDA to build better housing.
Thank you. Sylvia, would you like to ask some questions? Don't forget to unmute yourself.
Yep, thank you, Mr. Chairman. And Dr. Fauci, I'll begin with you. I want to follow up on this notion of mobile units. Does this mean that a mobile unit will actually go to the farms, much like a taco truck goes to an employee site, and actually administer the vaccines? And secondly, will people still have to go online somewhere and access registration and the vaccine through some technology? Because I'm concerned that many farm workers don't have access to computers, to Wi-Fi, and may not be able to navigate the system. So are you using the taco truck model, where food model, where we go to the job site and people can just on-site registration and get the shot that day, kind of like I still remember when the bookmobile would come to the countryside where I grew up with books. Will it be made easy so that we can achieve that equity that you're talking about?
It's definitely the taco truck model, as a matter of fact. So that's the whole purpose. And it will be mobile units going into communities. And I would hope that it would also be the farm worker community. I think we can make sure that that happens, but it will not require any pre-registering or predetermination, which is the whole purpose of the mobile unit. It really is, like you were alluding to, a taco truck or an ice cream truck. You pull into the area, people come up, they line up, they sign up, they get vaccinated, and that's it. You're not going to have to make an appointment for a mobile truck.
So we'll go out to the fields then to make it.
Congressman Garcia, I can't guarantee that that is in the mix, but I would be surprised if it were not. And I think a quick call from Raul Ruiz to the medical unit would make that happen. I'll try myself. In fact, I have a meeting this evening with the team. I will bring up that I was on this webinar right now, and that came up to make sure that we do get that mobile unit to the farm workers.
Well, thank you for that, because I know that transportation is always a challenge,
right,
in rural areas and farm worker areas. So have as easy as we need to make it as easy as possible so more people get the vaccine. Mr. Secretary, I wanted to ask you a follow-up about the housing for farm workers. I know in Texas, I think we've got like 250,000 farms, and millions of Texans do some sort of farming, and there's a lot of barriers to housing in rural areas, not just for farm workers, but for many others. Can you tell me more about this housing and how is it working? How do people sign up to try to see if there's some in their area? Tell us a little more, please.
It is working, Congresswoman, but I would say that it's probably not large enough a program to actually cover all of the people that you and I are concerned about. That's why it's important, first, to see if we can get additional resources into the program. Secondly, that's why the Farm Worker Modernization Act is so important, because by bringing these folks out of the shadows, then potentially they could also benefit from some of the other housing assistance programs that we have at USDA, which reach a much broader audience and provide more help and assistance. So I think it's a combination of two of those things. I might also add it in response to the question that you directed to Dr. Fauci. The Department of Agriculture, as you know, was given in the American Rescue Plan $500 million that is designed to provide resources to rural health facilities and operations, in part to assist in creating more vaccination opportunities. So it's conceivable that those resources could form a partnership between the local hospital and this effort to get a truck out into the farm fields. There's a partnership opportunity there that states ought to be seriously thinking about.
Well, you anticipated the follow-up question because I was going to ask that if there were in the nature of housing projects where you could have a clinic readily available for the COVID vaccine, but for testing and for some of the what the doctors call some of the usual screenings that you can do for better health outcomes.
You can do that, and also at that point in time, you can also, to the extent folks are available to participate in these programs, you could also talk about SNAP, and you can talk about WIC, and you can talk about rental assistance. You can talk about a variety of programs that could be available that also, I think, create a stronger health foundation, if you will, so people can ward off the virus as best they can if they have proper nutrition, if they have decent housing, and if they have less stress, concerned about whether or not they have resources to make the next rent payment.
Thank you, Mr. Secretary. Mr. Chairman, I yield.
Thank you very much. Dr. Fauci, during our numerous oversight hearings, we've talked about the different phases of vaccine development. We talked about initially the research and development of the vaccine effort. We talked about the massive production. We talked about the distribution, and we talk about the administration. None of that works with equity unless you prioritize those that are most at risk of getting infected and dying. And even after you prioritize, you have to allocate vaccines. And oftentimes at the ground level, that's where the missing piece is, where they may put priority of the underserved Hispanic or farm worker communities, but most of the vaccines are going elsewhere. And then finally, methodology in the administering of the vaccine is so key, is to be able to partner with local organizations, to go into the fields, to go to the work site, to go to the housing developments, to identify the risks and address those risks head on. The Biden Equity Task Force has developed an incredible program with Rite Aid pharmacies. I've taken the retail pharmacies. I've worked with Rite Aid, for example, to go into the farm worker community, the high schools, the trailer parks to inoculate farm workers. The FQHC's community health program is another way of doing that. Also working with growers like the Coachella Valley Growers Association to provide the worksite vaccination campaigns with the county and other collaboratives like the Desert Healthcare District's Equity Task Force Collaborative is going to be key, working with promotoras. What is your message to the local organizations that are working so hard to get the vaccine in the arms of our most vulnerable, highest risk individuals?
Well, the message is to make sure that you advocate to get the supply that you need, because as you know, Congressman Ruiz, that the allocations are made on a population prorated basis. And then the decision is made locally as to the distribution. So I would hope that there would be a strong advocacy to make sure that the actual doses get to the people who are in most need. As you know, the way it's going right now, the president has made it clear that starting on May 1st, everyone will be eligible to be vaccinated. You will no longer have to be in a special priority group. So we are rapidly getting to the point where you can just get vaccines and vaccinate virtually anybody in the farm worker group. And that's going to be coming soon. The thing we've got to make sure that there's enough doses that are allocated to that group to get it. And I think that's going to be local advocacy is going to do that, because the totality of the doses go to the individual states. And then from the states, it gets allocated locally. So I would just want to make sure that you have an advocate that's saying we need our share of doses in the farm worker group.
You know, it's important to have that allocation as part of the equation of the vaccination effort from the top as well. So for example, the federal program, the retail pharmacy program, ensures that 40% of the vaccines go into communities with a high social vulnerability index. We need more of these equity metrics that determine how the county or the state will allocate these vaccines into these hardest hit communities. And the final question is to you, Secretary Vilsack. Community collaboration is going to be key to effectively protect our farm workers, working with growers, working with our farm worker organization, but also with local nonprofits. We're having some incredible here in my district, including the community health workers or the promotoras or the health districts. What is USDA doing to foster those relationships, to empower local communities to do the hard work in the hardest to reach communities and get our most vulnerable vaccinated?
Well, let me make a couple of comments in response to that question and also the previous question. The USDA has an interesting heat map called Distress Community Index. It basically breaks down by county, every single county in the United States, and highlights the most distressed, persistently poor counties in each state. So that may be one area that could potentially be used by governors to make a determination about allotments and distribution of vaccines, so that you're assured that the distressed community areas of the state are dealt with. I would say, let me start with where I ended with Congresswoman Garcia. It's a $500 million opportunity for us to connect those community activities and those nonprofit organizations with the healthcare community. Resources that are going to be provided to the state. The state can then distribute these resources to facilities that can partner with nonprofits. Why is that important? Because frankly, with all due respect to Dr. Fauci and everybody associated with the government, a lot of folks aren't necessarily trusting us on this issue of vaccination. But if we are linked to someone who is from the community, from a community building organization, from a nonprofit organization that has the trust of individuals who might be a little bit skeptical about being vaccinated, they can be a very powerful messenger in terms of encouraging people to participate. I saw this myself at the Corinthian Baptist Church on Saturday here in Des Moines. African-American church, pastors from those churches got vaccinated in public, and the people from their churches flocked to get vaccinated because they knew if the pastor thought it was safe enough, then it must be safe enough. So I would strongly encourage us to find ways to link up to those nonprofit organizations to allow them to work with us to build the trust so more people get vaccinated.
Thank you very much to the both of you. Thank you, Dr. Fauci. Thank you, Secretary Vilsack, for joining us today for this critical discussion on Farm Worker Awareness Week. We've brought a deeper understanding to the conditions, the risks, and also the resiliency of the farm worker community. I know that both of you appreciate their labor, their hard work, their sacrifice, seeking a better life through their work in order to feed us. We didn't talk about the importance of nutrition, but now more than ever, we need to keep our immune systems up. We need to eat the vegetables and the fruits and the natural food that comes from our ground to really help us defeat this virus, stay healthy, and prevent getting sick. So thank you very much. I appreciate the both of you, and I'm sure we'll see each other in the halls of Congress or at a committee hearing sometime soon. This concludes our first panel. Next, I would like to welcome our next panel. Each speaker will provide 3 minutes of opening remarks, followed by a question and answer discussion. Our first speaker is United Farm Workers President Teresa Romero. She is the first Latina and first immigrant woman to become president of a national union in the United States. Que orgullo! What you make us very proud. So, Miss Romero, the floor is yours. You have 3 minutes.
Thank you very much, Chairman Rees and fellow members of Congress of the Congressional Hispanic Caucus. Thank you for convening this timely and urgent conversation about how to protect farm workers from COVID. The past year has been a time of great challenge and suffering for more than 2.5 million farm workers across the country. Historically, the agricultural sector has relied on people of color for food security, from predominantly African-American workers in the South to mostly migrant and seasonal workers from Mexico and Central America. About half of the US farm workers are undocumented, and they also face language barriers, issues that limit their ability to speak out in the workplace and enforce their rights against a range of abuses and unsafe working conditions. In California and the Pacific Northwest, farm workers suffer from a perfect storm of daily perils in 2020. They were the coronavirus pandemic, extreme heat, and choking smoke from wildfires. Farm workers often must live and commute and toil in overcrowded, substandard, and unsanitary conditions. The challenges are disheartening. Field workers can shelter in place or work from home. Federal, state, and local governments have classified them as essential workers. They must go to their jobs to feed America. Lack of transportation to and from the fields is an even bigger problem, which means that farm workers must commute with others and or rely on transportation provided by the employer or the farm labor contractors. Even if PPE and social distances are observed in fields and packing houses, which UFW surveys show that is too often not the case, farm workers frequently find themselves in close quarters. As you, Chairman Ruiz, mentioned, and you, Congresswoman Garcia, mentioned, they often lived in cramped, multi-generational households. And if they become ill with the virus or exposed to others who are sick, they have no other place to go in quarantine. When COVID first emerged, the UFW urged unionized employers to ensure proper protections. Most unionized employers did. The UFW also keeps in regular contact with about 50,000 plus farm workers, most of them non-union, through platforms exclusively for agricultural workers. We conduct surveys and receive a stream of comments and reports. They show too many non-union farm employers have not taken proper precautions to protect workers from the virus and provide the required PPE. All of this is why the coronavirus is disproportionately affecting agricultural workers and why infections and deaths are growing at alarming rates. At the national level, estimates suggest that more than 500,000 farm workers and farmers are likely to have contracted COVID-19. So government at all levels must do all it can to remedy these inequities. It begins with getting farm workers vaccinated as quick as possible. As Chairman Ruiz pointed out, in California, farm workers are literally dying to feed us. For the sake of farm workers' health and the nation's food security, there is much work to do to protect this population and vaccinate from COVID-19. A major survey just completed by the UFW Foundation, one of our sister organizations, received its responses via text from about 11,000 farm workers. The great majority said they want to get the vaccine. These results contradict the narrative among many journalists that large numbers of farm workers are reserved or skeptical about being vaccinated. That view has served as an excuse for some local health officials not to prioritize agricultural workers, since it's more challenging to reach, and we just talked about it, this rural immigration population. Farm workers are only hard to reach if we're not working with organizations that save them. And failure to prioritize farm workers would only exacerbate health disparities and put other food supply chain at risk. The UFW and the UFW Foundation know how to get the job done, and we have the work to show it. We are the Si Se Puede crowd. This month and next, we're joining with our partners in farm worker movement, as well as Latino groups and local governments to vaccinate thousands of farm workers throughout the community vaccination clinics, including our historic 40 acres property in the Nano and some unionized farms. In closing, I want to remind all of our listeners that food security is a national security issue. So I think Chairman Ruiz, the Hispanic Caucus, and members of the Agricultural Committee for ensuring that Congress and the administration are prioritizing farm workers in federal policy and COVID-19 funding. Sí se puede.
Sí se puede. Thank you so much. Now we will hear from the director of the National Institute on Minority Health and Health Disparities, Dr. Eliseo J. Perez Estable. He was born in Cuba and grew up in Miami, Florida. Also, I forgot to mention this while Dr. Fauci was on, but today is Doctor's Day. So happy Doctor's Day, Dr. Perez Estable. Happy Doctor's Day. Dr. Perez Estable, the floor is yours.
Thank you very much, Representative Ruiz. It's really an honor to be here with you again, even though virtually. And it's great to be with you as well, Representative Garcia, and to the Congressional Hispanic Caucus, and to all the trabajadores agrícolas out there. We really do appreciate and value everything that you do. So from the National Institutes of Health, I'll mention 4 things. First, at NIH, we stood up a program called the Community Engaged Alliance Against COVID-19. This was last August and September in response to the need to have better information on the science of this pandemic to our communities. Partnering with Dr. Gary Gibbons from the National Heart, Lung, Blood Institute, we have launched this program in 11 states, mostly in the Southeast, Arizona, California, and Michigan, about to expand to about 10 additional sites to really use trusted messengers, so local leaders, nurses, doctors, clergy, community organization leaders, to deliver the message about science, because we need to rebuild that trust in science that has been eroded by misinformation campaigns. Our initial goal was to get more participation in the studies on vaccines and therapeutics. Now that we have effective vaccines, we really are focusing on getting people vaccinated. Second, understanding why Latino populations are at higher risk of getting infected. I think this has been mentioned, but it's worth reiterating. It's not because of medical conditions. It's because Latinos are more likely to need to go out there and work. They don't have the privilege of working from home like I do. They live in more crowded settings. So if one person is infected, where will you shelter? Where will you isolate? There's one bathroom. How can you isolate in households like that? Whether they be 3 generations or 2 families or just less space, not single family homes with yards. And they also live in more crowded urban communities, not the agricultural workers, but the urban workers. And certainly the agricultural workers live in crowded housing, as you just heard. So I think that's the most important factors: work and crowding. And so more likely to be exposed to other people's air. And that's what leads to infection with COVID. And then these bring into the role of social determinants, as was mentioned, food security, economic instability. If you're living paycheck to paycheck and you lose your job, even for a month, while their lockdown was most drastic in some communities, where are you going to get the paycheck to pay rent or to buy food? And we read about the food pantries having long lines as we see that this need intensifies. And finally, let me just mention a research program that we have been working on for about a year called Rapid Acceleration of Diagnostics for Underserved Populations. It's a $300 million effort that was launched, appropriated by Congress last year to promote testing in underserved communities. We funded 59 projects in 33 states, including the District of Columbia and Puerto Rico and throughout the country. And we are just now beginning to see some of the results of that initial effort. So this is an area that we expect testing needs to continue to happen, even though we have effective vaccines, so that we can monitor the state of the pandemic. So thank you very much, Congressman Sweet.
Thank you very much. Our final speaker is someone I have worked with closely before I even became a congressman, as a community advocate and public health expert and a son of the farm worker community. She is also known as the founder of the Farm Workers Women's Movement in the United States since the late 80s. Millie Trevino Sauceda is the Board President Emeritus for Líderes Campesinas and Executive Director of Alianza Nacional de Campesinas. Ms. Treviño Sauceda, the floor is yours.
Yes, when you're talking about in the late 80s, I was 5 years old. No, I'm just kidding. I always use that. Thank you. Muchas gracias. Quiero darte las gracias, congresista Dr. Raúl Ruiz, por continuar siendo nuestro campeón en representación y atender los problemas y todos los retos que nuestra comunidad campesina enfrenta. So, muchísimas gracias. Eso de todo corazón. Representante Silvia García, lo mismo. Muchísimas gracias. Es un honor estar aquí. My name is Mili Treviño Sauceda. As I was told when I was 5 years old, you're going to be called Mili. Hermila Maria is my name, my real name, but Mili is how people know me. And we represent a coalition of 15 grassroots farmer women organizations throughout the nation. They're in 11 different states. And Líderes Campesinas is one of the founding organizations that moved towards pioneering this organization. And we are advocating for civil, constitutional, and human rights of the more than 700,000 campesinas and other workers, women workers throughout our farm and food systems, who are regularly subjected to an array of abuses, including sexual harassment and violence, wage theft, pesticide poisoning, and other toxic chemical exposures, aside from adding to what Teresa Romero also shared and Dr. Eliseo shared. And I'd like to share just very quick, and I had to put it in writing because if not, I'm going to go on tangents, saying other stuff. We have done a lot as farmworkers, aside from feeding the nation, we have done a lot in terms of when COVID started, in terms of calling on attention to the issues of farmworkers, farmer women and their families, and either via letters, meetings, visits with public officials, federal and state agencies to call attention to the lack of equity in getting the resources and or support. We were called essential workers finally last year when we have always been essential workers. We know that. We know that. We're doing a lot of work to build that trust, like Dr. Eliseo was talking about. Yes, we have been for decades trying to do that, but with the pandemic, it got worse, and so we had to restart doing that a lot. So I wanna share that as essential workers, campesinas and other immigrant women workers are the backbone of the nation's agricultural industry, who, despite the vulnerability to COVID-19, we have continued to feed the nation, as I was sharing earlier, and some of our colleagues were sharing earlier, and to sustain our families and communities during the pandemic. Across the country, over 89,000 farm and food system workers have tested positive for COVID-19, and over 400 workers have died. In California alone, campesinas and other farm and food system workers are more likely to die from COVID-19 than in any other industry. That's very sad, because they lack the basic protections and adequate wages. They do not have health insurance to start with. Many campesinas are also forced to work and travel in cramped, unsafe conditions and reside in crowded houses with no place to self-quarantine, just like Dr. Eliseo was talking about, and unsafe conditions. And the vast majority of campesinas are undocumented immigrants, temporary and seasonal workers, guest workers, and refugees who lack access to healthcare and medical services, or they fear accessing the few services that are made available to them because of their immigration status. We have a very, very broken system in different levels, and including immigration, as we all know. In addition to being at high risk of COVID-19 infection and death, campesinos also have added burden of homeschooling children, which poses an additional set of challenges, including the lack of access to technology, language barriers, and lack of adequate childcare without the federal assistance provided to date. Due to home confinement because of COVID lockdowns, campesinos have also faced an increase in domestic and sexual violence, which is very, very sad. Now, my conclusion is this. All of what I've said underscores the importance of securing essential protections and safeguards for campesinos and their families, such as we need to prioritize farm and food system workers in COVID vaccination, treatment, and outreach efforts, ensuring enactment of critical workplace health and safety measures like the Asunción Valdivia Heat Illness and Fatality Prevention Act, providing a pathway to citizenship for campesinas and their families through passage of critical legislation like the U.S. Citizenship Act of 2021 and the Citizenship for Essential Workers Act, and including campesinas and other farm and food system workers in COVID-19 relief and assistance efforts. Finally, we have always been essential. We know that, but we have not received essential workers. It's about time we're treated as essential. There is no recovery for some of us without relief for all of us. And this includes campesinas and their families. Teresa, si se puede, we need to continue. Dr. Raul Ruiz, Representative Silvia Garcia, muchísimas gracias. And Dr. Eliseo, thank you very much for, we feel honored to be here. And we will continue doing the building trust in terms of testing, the vaccinations, and also making sure we're still bringing food to our communities and getting other people involved. We don't see ourselves as saviors. We see ourselves as engaging the community. Thank you very much.
Thank you, Millie. And I can say from firsthand witness and experience the collaboration, the work we've done together during this pandemic to take testing into farm worker trailer parks, churches, schools, and make sure that the farm workers have. And thank you to all your promotoras who are continuing to serve, giving the vaccines and registering individuals in the communities. Thank you so much. I'm always impressed and proud of Líderes Campesinas and the work that you all do here locally and nationwide. I'll start off with the questions. We have a few minutes left. I'll give one question, then Silvia will continue with her question. But, you know, as an emergency medicine doctor, people come in to address acute crisis, the immediate emergencies, but those emergencies are oftentimes as a result of chronic conditions. And this pandemic disparity, as we've seen in the amount of deaths and the lack of vaccinations, is a reflection of the chronic disparities in the context in which our farm workers and Hispanic populations find themselves. So Dr. Eliseo Perez Estable, what do we need to do to address the chronic systematic disparities that farm workers experience so that we don't leave our farm workers vulnerable beyond this pandemic ever again?
Thank you, Dr. Ruiz, and congratulations to you too on Doctor's Day. That's the long ball game, right? So this pandemic has revealed this incredible disparity, just glaring differences in cases and mortality by population that I don't think anybody really was ready to predict in February of 2020. However, the underlying conditions that you're referring to, twice as much diabetes, uncontrolled diabetes, uncontrolled blood pressure, poorly managed asthma, excess or poor nutrition that leads then to other chronic conditions are all critical. And they all will depend on access to care, first of all. So you need to have some sort of health care coverage for everyone in some way. Second, have something that's readily available for a physician or a clinician, nurse practitioner, physician assistant, who the individual can depend on for managing these common chronic conditions. Bringing them under control takes years to get there. This is not something that we can fix with vaccines over a course of a year. This takes a long time and investment. And then building that trusting relationship between individual patients and their doctor, and where you have to overcome the language barriers, the cultural issues, and the confianza that the person will be there for you.
Thank you very much. It is a sad irony that although the United States is one of the only countries that can provide food for its enough capacity to provide food, that it is in fact the children of farm workers, 1 out of 3 experience food insecurity in our nation, if not more. It is the irony that those that pick our crops don't have access to affordable crops to stay healthy themselves. With that, Sylvia, you can please ask the next question.
Oh, thank you, Dr. Reese, and happy Doctor's Day. I didn't know that it was. I know that that this week is National Farm Workers Awareness Week, and tomorrow is Cesar's birthday. So I guess I was caught up in all the farm worker loyalty that I forgot about the doctor. So happy Doctor's Day. And Teresa, felicidades, congratulations, first woman president. I'm really proud. It's good to see some strong mujeres on the panel. And I wanted to talk just specifically about some of the issues that do face women who are farm workers. I know that Tilly, you mentioned some of them, but Teresa, is there anything else that we could be doing in Congress to make sure that we focus on las mujeres that are the caretakers, that are the heads of households sometimes, that are the ones that do have to manage to try to teach those kids from home now because they're not going to school? I mean, what else could we be doing to add to some of the legislation that we've passed? And of course, we're looking at the U.S. Citizenship Act, but what else could we be doing?
Thank you, Congresswoman Garcia, for the question, and happy Doctor's Day. It is important that we understand that women have, and it's not only in the fields, but it is especially difficult in the fields. They have 2 jobs every day. They go and work in the fields for 10, 12 hours, and they still come home and are mothers and wives and have to take the responsibilities of the household. Many of these women are single mothers. And if you think about right now, access to technology in rural areas is very difficult. Access to childcare, they're having to choose either I stay with my child because I cannot leave them alone, or I go to work to put food on the table. And even if they stay at home, they don't have the capacity and the ability to make sure that their kids are receiving the education that they need to receive. So the kids are falling behind because they don't have the access to the technology and the time to ensure that the children are taking the classes that they need to take. So these are needs, very special needs because of where they live, most of them rural communities. And if we had provide access and technology to these communities to make it a little easier for them, and care. They do not have the ability to leave their kids alone, and they can't bring them to work, and they can't stop working because they have to survive. If you think about it, farm workers make between 17 and that don't have a contract make between $17,000 and $19,000 a year. So being able to meet all these needs, it's impossible. So childcare, technology, access to remote schooling for the children it would be a huge difference for farm workers, and especially for women.
Thank you. And Tilly, did you want to add anything to that?
Millie? Yeah,
Oh, I'm
I
sorry.
will.
I thought it was Tilly.
Sorry.
Tilly,
That's okay. That's okay. Thank you for allowing me to respond to that. We feel that it's very, very important that we have long-term investment in childcare. Why? Because and education. Why? Because we've been talking about we don't know what's going to happen afterwards. There was a very, very large shift when because of COVID in terms of how we had to deal with stuff. Yes, we had to go out there and work. There's no virtual work for farm workers, but nonetheless, in terms of what happened with our children, like Teresa was talking about, dealing with deciding either stay home and not work and take care of your children and deal with the schooling. At the same time, take your children because you needed to work, and then certain growers using that opportunity to have children working or additional people working, and maybe only paying the parent, not necessarily paying. All these things are happening. So it's about being real, understanding all the different issues that are happening. We have, by doing the grassroots and being out there with the community, we're finding out so many things, so many more things. The pregnant women, we're not talking about pregnant women working. They have to work and they're already exposed to the chemicals. And then to top it off, we have found cases of women losing their fetus or having complications in their pregnancy because of COVID. And because of all this really ridiculous way how we've been treated as essential workers, quote unquote essential workers, having us work there. So for us, there's a lot of, we feel that the personal protective equipment is still needed and will continue still be needing it, and education, and then resources to the community. Yeah, promotoras are very good, very, very good in terms of what they do. We decided to call ourselves organizadoras. You know why? Because as organizers, we know that we continue the work being there, any funding or not. Okay, and for us, it's very, very important. Just to finish off, I think the making sure that the reauthorization of VAWA is very, very important. Why? Because violence against women. And if there's any rules and regulations, California is the one that has more rules and regulations. The enforcement, we need more funding for these agencies to have more people to enforce. Many people don't even know that all these regulations exist, or right. If they don't know or live in states where there's no regulations, it makes it even worse. So we need a lot of support. We need to be believed in what's going on. Yes, Representative Silvia Garcia, you know what? You reminded me of my childhood, my younger years, where when we were working, we still see that here in the Coachella Valley and every single states where we are at. We still see that. Why? Because we're only treated as essential because we need to work, but we're not treated as essential as human beings.
Well, you're doing the essential work and not getting the essential pay. So, yes. So thank you for all your work. Y si se puede. And Mr. Chairman, I yield back to you, sir.
Thank you. Thank you so much, Silvia. Thank you, Teresa and Millie, for your very powerful words, as always, speaking from the heart. And that's one of the things, hopefully, that we can do in promoting the Farm Worker Awareness Week is that we've talked about the conditions of farm workers and equities and the risks that farm workers and their families experience, and Latinas in particular, the campesinas, and we have them in our mind. And what we need to do is have them genuinely in our hearts, because our hearts will then determine what we think and then how we act, not only in our support and recognition, but also in policy in our country so that we can truly value through resources and policies that will really provide the safety, the sustainability, and the security that our farm worker communities and families need and deserve in the work that they do for everybody else. But one of the striking things, and that was our last question, and we'll close here. One of the striking things as a son of campesinos, as one who grew up initially in a trailer park, as one who still today works in public health in the hardest to reach areas, is the amount of dignity and the amount of integrity and the amount of hard work and the amount of faith and the amount of resiliency and the amount of determination that our farm worker families have. That although they live in the most underserved communities in our nation, although they live in the most environmentally unhealthy, unjust locations where they're exposed to the dust and the particulate matters and the arsenic in the waters, for example, in our trailer parks, or the pesticides and the chemicals, and although our children go to school in the most under-resourced schools and dilapidated schools, and oftentimes in little trailers, makeshift classrooms that's overcrowded, although they live in the most overcrowded housing in our country, they still dream, they still work hard, they still believe in their work in our nation, and they sacrifice so much to give their children opportunities that they never had, like my parents did for me. So, we really appreciate you taking the time to share your knowledge and insights as we continue working to protect farm workers from COVID-19. At this point, I'd like Sylvia Garcia, if you could give a brief closing remarks, and then I'll close with some words in Spanish as well.
Well, thank you, Mr. Chairman, and thank you to all the panel members. It's been great to spend some time with you, especially since this is a week that it is all about awareness of farm workers, and the day before Cesar Chavez's birthday. We cannot forget farm workers. We cannot forget farm workers. All of us have them in our heart, and I think the chairman's right. It's about stirring that heart in other people to make sure they fully understand the contributions that are made by farm workers. I think the farm labor has always been undervalued and forgotten. And I think that as we approach a place where we're already reaching the 200 million shot mark, and we're trying to get everybody vaccinated, that when they say we will not leave anyone behind, that they truly don't leave anyone behind. Not because of where they live or what language barrier they may have or what access they may not have. We need to make sure that everyone's covered. And I'm going to hold Dr. Fauci to his word and ask the chairman to please call and make sure that they use the taco truck model of sending the shots to the people instead of the people to the shots. Because I've been fighting that here locally in the Houston area too. My whole mantra is, shots to people, not people to shots, because, in our city, we're so large that some of the sites are just, there's no bus routes, there's no way to get there. So we got to make sure that people have real access, not just access on paper that looks good, but that really works for people. So please count on me to be a co-champion with Dr. Reese. I've supported the farm workers from day one. I still remember when Cesar first came to Houston. I still have a picture with him. I still have I have my old farm worker shirt. And frankly, I probably should have worn it today. But I'll be there with you today. I'll be with you tomorrow and every day until we make sure that farm workers are treated fairly, with equity and with dignity. And that all farm worker children have the opportunity that Dr. Reese and I did to succeed and fulfill their dreams, because that's what this country's about. So thank you all for having me. And Dr. Reese, back to you.
Sylvia, as always, you brought chills to my skin. You're such an inspiration and such a powerhouse within the Congressional Hispanic Caucus. And you truly are a national leader for so many communities and so many causes. And we really appreciate you and your words and your life experience working in the fields, picking cotton. There is light at the end of the tunnel, but we must remain vigilant in continuing to practice safety precautions like wearing a mask, washing hands frequently, and practicing physical distancing. We must do this in honor of our mothers, our grandmothers, for the sacrifice that they did for all of us in working in the fields so hard. I heard stories. My grandmother would wake up at 4 a.m. up in the Northern California area on some summers with my aunts to start making the tortillas to sell them for a nickel for the farm workers as they went out to the field. And I do too remember Cesar Chavez organizing our parents at the Coachella Valley High School here in the district. And in fact, Celia, when I was a pre-med student and undergrad at UCLA, I had a poster of a quote from Cesar Chavez that was my guiding drive often. And I saw it every night as I dreamed about becoming a doctor. And it said, the end goal of all education should surely be service to the community. And that was that fire that I developed early as a boy, dreaming in the fields in a farm worker trailer park about serving our nation, serving the community, and using the education for the betterment of others. And so together, we can take that drive that our parents taught us so much, and we can defeat the virus. We can build back better, and we can create a better life for those that sacrifice so much to feed all of us in our country. Gracias a todos por acompañarnos hoy. Aunque hay luz en el final del túnel, debemos permanecer atentos a seguir practicando precauciones de seguridad como usar una mascarilla, lavarse las manos con frecuencia y practicar el distanciamiento físico. Juntos podemos derrotar al virus. I want to thank all of our panelists today. I want to thank you all for your incredible work in our communities, for your leadership, for your understanding. And today and throughout the week and every day, I want to thank our farm workers. I want to thank all of those who have worked in the fields with calloused hands and tired backs with minimal rest day in and day out, who have sacrificed so much. I want to thank las campesinas who endure so much injustice, but continue to stand up tall and fight with resiliency and demand a more equitable and just society for their families and for themselves. I want to thank you and be safe, appreciate our farm workers, and remember them during your next meal.